When you have a cardiovascular problem, you want to get the best care possible. And one way to ensure that you will receive Gold Star treatment is to look for something specific when you visit the office or website.
Dr. Jason Roberts, General Manager of Non-Invasive Cardiovascular Services with First Coast Cardiovascular Institute, is here to tell us more about cardiovascular accreditation, why it's so important, what to look for, and how it can help cut down on our healthcare costs, which we love very much.
Everybody likes good, affordable healthcare.
Yes.
You know, haven't met anybody who didn't yet. Firstly, I just want to say Happy Veterans Day to all the veterans. We have a large amount of veteran patients, and it's always a pleasure to have them on board as well. So Happy Veterans Day.
Absolutely. So anybody that's not familiar with what cardiovascular accreditation is, what is that and how does that help?
You know, really at this point, any healthcare facility, probably the news station, has some sort of accreditation. So if you're having medical services that you go to cardiovascular services, you want to be in an accredited facility. And if you don't know what that means, you can see some of the badges that are being shown right now. Ask. There's nothing more powerful than a question. Right. So as a patient, just ask. If you're having any type of testing, surgery, procedure, ask. Ask the facility if they're accredited.
Why is that important, and how does that then reduce the overall costs?
What happens when you're in an accredited facility, the cost savings get passed on to the patient and the entire system by the way that we do qualitative measures and things of that nature. So any type of testing that you have is going to be based or correlated on bigger ticket items like CAT scans and MRIs, and we use those findings and those qualitative metrics to give out high quality testing information based on that. So we basically can reduce the cost that way to the patient.
And if they're seeking an accredited cardiovascular, what things should they be asking? What should they be looking for specifically?
First of all, those accreditation badges that we were just showed, generally those are badges of honor. You know, so as soon as you walk in the front door, they'll probably be displayed right in the case, right on the door, anywhere. And then once again, if you don't see those, go ahead and ask. And just always ask if a facility is accredited or not. Right. It's that simple. Any type of testing you're going to have.
So what is First Coast Cardiovascular Institute specifically? What are you guys doing to lower the cost of health care for the patients and also just the health system?
That's a pretty good question. We're actually doing a lot of research, background data collection that we have. We have a very large patient base. So we've been collecting data over, you know, multiple years, and we've been presenting this data as well to insurers and the patients. And since we have our own freestanding cath lab and we have all of our cardiovascular services are inclusive, we're basically cutting costs this way. So since we're doing cutting edge medicine, as you can see in this chart here, we can basically save patients in the system 50% coming to a freestanding clinic. Not to mention co-pays for the patients. Patients are generally, our co-pays are $20 to $50. In other institutions and inpatient centers, it could be hundreds of dollars, and then also deductibles. So, you know, the main thing that we want to get at is that you are going to get high quality health care, cutting edge medicine in our facility, and we want to basically present these savings to the insurers and the patients as well, but also ensure them that when you come here, you are getting, you know, top of the line, no debate about that.
And back to the accreditation, sure. I mean, that's what keeps resonating with me, is that this is your life, this is your health.
Absolutely.
Ask the questions. Don't be like, well, maybe I don't want to rub them the wrong. This is you. This is all about you.
You're right, and it's amazing. I mean, people will haggle about anything, but when it comes to healthcare, they just it just falls to the wayside. Like, you know, like my adage my mom says, you know, my mom will give you the hardest time in the world when she goes to see a physician, but won't do it when she sees something wrong on her, you know, restaurant bill. You know. So I hate to do the comparison like that, but you have to realize at this point that it's 2013. Every service that you get provided for in a healthcare system should be accredited, and there should be some way to determine whether or not where you're at is accredited.
And a good resource, I guess, to go and do, you know, some fact finding. Obviously, you can go, you can call, website. What?
You can go on our website, firstcoastcardio.com, and click on patient resources, and we have a whole entire resource page for patients that not only show our accreditation, but links to those accreditation pages and what that really stands for. But at the end of the day, it's just really, accreditation means that you are qualitative medical services, and, you know, at a fraction of the price, really. We do a lot of cost saving reductions based on accredited labs.
With the cost of health care, we appreciate that.
Yes.
Thank you so
Thank
much,
you.
Dr.
Thank you.
Roberts and First Coast Cardiovascular Institute, of course, for coming on and sponsoring this
Thank you.
segment. Remember to know your body, know your risk factors, and work with your doctors to address them.
If you want more information about the heart disease from First Coast Cardiovascular Institute, visit firstcoastcardio.com or call them at 904-493-3333.